And we're going to talk now about autism and intellectual and developmental disabilities, and think about inclusive practices for accessible telehealth. I'll be introducing Dr. Holly Tabor, my friend and colleague, who will then be introducing her co-panelist, Dr. Susanna Swarska. And give me just one moment. Welcome, Holly. So Holly Tabor is a friend and a colleague, and she's the director of the Stanford Center for Biomedical Ethics. She's an associate professor of medicine at Stanford, and also by courtesy, epidemiology and population health. She's co-chair of the ethics committee at the Stanford Hospital and the Lucile Packard Children's Hospital. And she's really a globally recognized expert on ethical issues surrounding healthcare and research for persons with disabilities, especially IDD, and on the ethical, legal, and social issues in genetics. She's been doing work in autism now for well over a decade, and her research has shed light on the risks and benefits of participating in genomic research, and particularly around rare and undiagnosed diseases. She's editor-in-chief of the American Journal of Bioethical Empirical Research, and is going to share also some of her recent work she's been doing in IDD and telehealth. So with that, I'm pleased to turn this over to Dr. Holly Tabor.
Thank you very much, Dr. Srinivasan, and thank you to Dr. Poulos and to the other organizers and to the other speakers. Can I just get a thumbs up if everybody can hear me okay? Good. Okay, great. I'm very excited to be able to present today with my colleague, Zuzana Skvarkova. I hope I said that right, Zuzana. I've been working hard on something that's very near and dear to my heart, both personally and professionally, which is thinking about how we can make healthcare more inclusive for people with autism and for other intellectual and developmental disabilities, but specifically how we can make telehealth and telemedicine more inclusive. Next slide. So just briefly, I think Dr. Srinivasan introduced me. I am a white woman with blue eyes and sort of dirty blonde graying hair, and I'm wearing a white shirt with black dots on it, and I'm in front of a background of the Stanford School of Medicine. And I'm extremely excited to co-present this and co-conceptualize this presentation with Zuzana Skvarkova. Zuzana, do you want to just introduce yourself first? That would be great.
Yeah, of course. Thank you so much, Dr. Tabor. I'm very excited to be speaking with everybody today. My name is Zuzana Skvarkova, and I'm a white female in her mid-20s with long, length brown hair, and I'm wearing a tan turtleneck. I have light makeup applied, green eyes, and I'm sitting in front of a desk in a well-lit room with a blurred background. And I'm very excited to be speaking with Dr. Tabor today.
Thank you. We met because Ms. Skvarkova is a research associate at Arizona State University on a very exciting project with the BRAIN Initiative about autism and data sharing, particularly in the context of genetics research. And we met and we were able to learn that we had a lot of interest in common in the space about the intersection of ethics and disability and healthcare. And I really realized that there was really perhaps no one better who's thought more about this to come present with us. Zuzana also identifies, as she'll talk in a minute, about as autistic or having autism herself, and I think that's incredibly important when we're talking about these issues, as has been demonstrated throughout the conference today. Next slide, please. So I have no conflicts of interest to declare, but I am the parent of two adult sons, actually, one of whom has autism. And Zuzana, do you want to read your conflict of interest statement?
And I have no conflicts of interest to report, other than the fact that I am here speaking with my lived experience as an autistic individual myself. So that informs my perspective and it represents my opinion alone. But I'm very excited to also be talking about this as a community member as well.
Great. Thank you. Next slide. I want to briefly go over some of our session goals. So first, we hope to describe some of the current knowledge about telehealth for people with IDD and autism. And I think it's worth mentioning that we are talking about those together. In part, some of the research that's been done and some of the data that exists is about people who span those two groups together. Also with the recognition, as has come up in other sessions from today's conference, that there's a lot of intersectionality between specific disabilities and other disabilities, physical disabilities and non-physical disabilities, visible and invisible, and disability and other identities, including marginalized, underserved identities. So we're going to be talking about it that way for the purposes of our talk today. Then I'm going to share some data from a project that I've been co-leading about the perspectives of people with IDD and autism about the use of telehealth during the pandemic, which has already been mentioned was sort of a time where there was an increase in availability and a different set of experiences that had existed in the previous history of telehealth. Then we hope to identify opportunities for action to improve telehealth accessibility and benefits for people with IDD autism. You will see some themes in common with some of the other talks today, but maybe some themes that also might be very specific to this population. And examine best practices for creating inclusive telehealth environment for individuals with IDD and autism. Next slide. So with permission, this is my son, Colin, who has autism. He is a tuba player, as you can see from the slide here. I share his picture with his permission and his perspective because being his parent actually has taught me a great deal about some of the challenges that people with disabilities in general and autism face in healthcare, and through the other people that I've gotten to know and the other autistic people that I've gotten to know through him and through being his parent, and then also through my clinical roles as well. Colin is a musician, as I said. Next slide, please. But in spite of that, when he is in a in-person clinical waiting area, this is sometimes what it feels like to him, and not in a good way. He's more this is a picture of for a visual description of a young woman holding her ears and looking distressed, and next to her is a young boy playing a trumpet very loudly, and the impression is that this is extremely disruptive and sensorily overwhelming to the girl. And this is how many clinic spaces are experienced by my son, and how I've heard they're experienced by many other autistic people of all ages, and it really is a barrier to care. And so one of the things that was really interesting to me about the topic of telehealth is how could telehealth mitigate some of the barriers that some people with autism face, but also how might it perhaps even unintentionally exacerbate some of the barriers to healthcare that people with autism and IDD face. Next slide, please. This is another picture, I think, of how many people with autism and IDD, and honestly, how many of us experience healthcare. This is a sort of mod kind of graphic cartoon. There's a man with a surgical mask and a hat, looking very stern, and then another man and a woman with a big orange background and a bright light. And again, I think just that many people, particularly with IDD and autism, don't experience clinic spaces and clinic encounters as being very friendly, and they can be very stressful for them and make it hard for them to describe what's wrong, describe what their healthcare needs are, and to get the kind of care that they need. Next slide, please. So what do we know about IDD and autism and telemedicine? So there have been some existing studies, not a lot, and the ones that exist really have focused on a couple of specific subcategories. One is specific clinics, so clinics that are really designed to meet the healthcare needs of people with autism or other IDD conditions. Not for the most part, not general healthcare clinics. They've also focused on pediatric populations. That's very important. Sometimes we think about autism first as a pediatric condition, but there are people with autism who are kids grow up to be people with autism who are adults, and we don't have a lot of data on adults. There's also been some focus on interventions or specialists, particularly in autism, certain kinds of interventions that can be delivered through telehealth, particularly for children with autism, but not on basic healthcare for the most part. Though there's one study in Canada that does look at primary healthcare, but there's almost no studies looking at primary healthcare in adults in a US setting. There's only one published study that involves, we call it AIDD, or adults with IDD, in the research design, and none of them leveraged what we call community-based participatory research methodology, or CBPR. And this is a kind of methodology where we actually involve people with any particular condition or health risk or population in the design, conduct, analysis, and dissemination of the research study from the very beginning. And there are very few studies that have done that for people with autism or IDD, particularly about telemedicine. As we've talked about throughout the day, there are some guidelines and best practices for telemedicine and telehealth, but there are none about how it should be designed, implemented, or optimized for adults with intellectual and developmental disabilities, including autism. And existing telemedicine guidelines really do not address accessibility for AIDD. Some are not great at accessibility at all, as has been brought up by several other speakers today. Next slide, please. So this was a part of a study that we were very fortunate to do that was funded by CORI, or the Patient-Centered Outcomes Research Institute, and we called this study IDD Transform. I was very lucky to work with colleagues across a lot of disciplines, including Dr. Srinivasan. And the mission of this study was to improve health care, and health outcomes for adults with IDD in a measurable way by engaging and centering the voices of adults with IDD themselves, using, as I said, community-based participatory methodology throughout. Next slide, please. And this is a picture from our website. This is a picture of some of the members of our core advisory board, which does every aspect of the study. That includes research staff who work at Stanford, but it also includes adults with intellectual disabilities themselves across a range of different identities, parents and family members, and clinicians and researchers. And it's a really wonderful group. We've built really deep bonds over the last 4 years, and I can't say enough how much I've benefited from being able to really work side by side with people with autism and intellectual disabilities themselves every step of the way. Next slide, please. So our core advisory board helped develop and pilot a focus group guide about pandemic healthcare experiences in general, including experiences with telemedicine. And for the purposes of this study, we defined telemedicine as a visit with a healthcare provider that does not take place physically in person, but takes place over video chat using either a phone or a tablet, like an iPad or a computer. We've heard about some different definitions today, but this is the one we used for this study. We recruited both adults with intellectual and developmental disabilities and caregivers to participate in these focus groups, and we did it in partnership with 2 local organizations that serve this important population, Special Olympics Northern California and PARCA, or Partners and Advocates for Remarkable Children and Adults. And then we also used snowball sampling. And we ended up having 6 focus groups in 2022, 4 with adults with intellectual and developmental disabilities, and actually let's just say 2 with caregivers of adults with intellectual and developmental disabilities. And for those focus groups, we tried to recruit intentionally people who had adult children with IDD, who because of their disability found it challenging to participate in a focus group. So that included people with communication challenges, and that included people also with other kinds of cognitive and behavioral challenges that would make focus group participation challenging, but we really wanted to hear about their perspectives and their caregivers' perspectives on telehealth. Next slide, please. So I'm just going to jump to a couple of the themes. One of the themes, we had themes about positive and negative experiences with telehealth. And again, this is people with autism and with other intellectual and developmental disabilities. One adult said, what I liked about it was I didn't have to go into the office and worry about transportation, just do it like in the comfort of my own room. And then another one said, I liked telemedicine because then I could talk to my doctor about more personal stuff, like, because I got the next plan and birth control implant in, so I could talk to her about what to expect. So I think there were definitely people who highlighted both the way it made it easier to get to see a doctor, as others have spoken about today, and some people found it more private, although on the other hand, you could imagine that being at home could feel less private for some people as well, but nobody said that in this particular study. Next slide, please. Another positive was it minimized transitions and behavioral challenges, and this was something that came up especially among the caregiver groups. When he's getting older, it's too hard for him to attend in-person visits because transition is the main problem for him. And then there was a very long quote, which I've only shown part of here in the second quote here, from a parent saying, we love telemedicine, the amount of time it takes to get to prepare for the appointment. I've been gone from the house for 5 to 6 hours, and all it was a doctor's appointment. And she went through all the steps she and her son had to go through to get her to the doctor. So then she described the telehealth experience, and she said, so this way it lasts for about 15 minutes and we're done. We go about our day and I love it. It's easier for him. Next slide, please. One other theme that came up was that many people with IDD were actually quite concerned about COVID risk in the beginning of the pandemic. That may not be unique to that population, but it also may be. Several of them talked about how it really triggered some of their anxieties in general, and so they were much more worried about going into the doctor's office than they ever had been. One parent of someone with IDD said that their daughter was COVID phobic. She thought if she went into the doctor's office, she would get COVID, so we preferred telemedicine as triage. And I think that was a really important theme, is that many people valued that during the pandemic, it became easier to use telemedicine as a triage to decide when and whether they needed to go in or whether something could be handled over the phone. So they could make the effort to go in when it was absolutely needed, but maybe not do it if it was something that could be handled without having to see the caregiver in person, the provider in person. Next slide, please. There were some negative things that were mentioned in our focus groups. One was something, again, that's come up in this wonderful meeting today about barriers to personal connection and communication. So several people had described situations where they had challenges making a personal connection with the provider over video. And they particularly highlighted that this was true if it was a provider that they've never seen in person before. And I think that points to an opportunity, again, using universal design, not just for people with autism and intellectual and developmental disabilities, but everybody. The idea that if you've never connected with a provider before, you may need extra scaffolding and support to be able to facilitate that. And Susanna's going to talk a little bit about some of that in a minute. Several people talked about concerns with internet connectivity and consistency using apps. It wasn't that they didn't have internet at all, and it wasn't that they didn't have tools or software to use. It's that their internet connection wasn't strong enough. The other thing is several people mentioned that it was hard to do it the first time that they did it. And I think, again, that's an opportunity for telehealth, is how can we scaffold and coach people through the first time you use it or the second time you use it so it can be more comfortable at a subsequent visit. Interestingly, particularly among the people with autism, there were some articulated worries about whether or not, because of telemedicine, it would be harder to get things in person that required a physical exam. So I talked about someone looking in your ear, someone looking in your eyes, someone doing physical therapy. Several parents said they were worried that someone just wouldn't get high quality care if they didn't get eyes on them in person. And I think people were worried that if telemedicine became more popular, that they would have to fight harder to get in-person appointments when they needed them. And so I think that's another opportunity for how to provide FAQs, guidance, but also sort of decision trees to help people figure out and be reassured that they can get in-person care when they need it or when it's better for them or better meets their accommodations needs. Next slide, please. We did ask about mental health, and there were both positive and telemental health, and there were both positive and negative themes that came up. Among the positives was avoiding travel and time of in-person visits. This was especially true for people with autism and IDD who worked. They found it very hard to get to their mental health care providers and preferred to do it over telehealth. And several people, including parents of adults who had more significant behavioral challenges, said that it was easier to get access to providers for crises and access to medications. And one parent gave us a very moving description of an incident where she couldn't get her son to go in because of his incredibly poor deteriorating mental health, and she was able to get help through telehealth when they needed it. And again, a negative was lack of personal connection. Several people said that they'd been optimistic about starting telemental health, but then their adult child or their sibling just couldn't make a connection with a provider in a way that would make for effective telemental health care. Next slide, please. So the take-home messages from our data are that telemedicine can minimize some barriers, I think, for the autism and IDD population, and therefore potentially increase access to healthcare, at least for some people. But I think one of our themes here is that significant barriers will remain, and telemedicine, as others have said today, will not solve all accessibility challenges and may create new ones. There are fundamental gaps in knowledge and lack of access to accommodations that still persist and remain really critical needs. And there are gaps and accommodations that are really necessary for telehealth. And we need to think about that and create some standards, I think, for how different telehealth apps and portals and also how healthcare institutions can address those. And just to mention, that's not just with telemedicine. I think most healthcare institutions, including Stanford, can do a better job pointing out how we can provide accommodations of all kinds in all of our healthcare modalities, including telehealth. So as is with so many things, with COVID in particular, it's an exacerbation of problems and challenges that existed already. Empirical evidence and clinical trials are really needed to develop and tailor telemedicine to meet the healthcare needs of adults with IDD and autism, as well as easy to use plain language tools for patients, caregivers, allies, and providers. And again, I think this is another opportunity for universal design. People with autism and IDD really need this and arguably have a right under the law to it, but it's probably something that will benefit everybody. Next slide, please. And I like images. I've talked about scaffolding a couple times, but I think part of the theme here is how can we provide scaffolding for telehealth, scaffolding on how to use it, but also scaffolding on how to triage and how to get higher levels of care or in-person care when that's better for the person. And I think if we think about it that way, that can really help us break it down and figure out what the easiest and most practical solutions are. Next slide. I also like images to explain things. And I think, as I said, it's not a perfect solution to accessibility. I like this image because it's a puzzle piece, but it's the wrong size. And maybe it helps fill some of the gaps, but it doesn't actually complete the puzzle. And I think about telehealth and telemedicine that way for people with autism and IDD. Next slide, please. And this is a puzzle maker that actually is in the Bay Area that I really like. And the puzzle pieces on the right make up the puzzle on the left. And I think I like to think about telehealth and telemedicine and IDD and autism this way. The individual pieces are actually shapes in of themselves. And when you put them together, they make a more whole puzzle and a bigger picture. And I think telemedicine is a tool, but we need all the other tools and we need it to fit just right. And honestly, these kinds of puzzles are a lot harder to complete than the traditional kind of puzzles. And I think figuring out how telemedicine is going to make healthcare more accessible and improve the health of people with autism and IDD is going to be a harder puzzle, but an exciting puzzle to figure out how to leverage these tools. Next slide. And then finally, these are pictures from down by Pacific Grove. I think thinking again about legacies and solutions. So the picture on the left is a picture of a fence with an old tree, and there are a bunch of lines on it that show where there were vines before that have now been cut down. They're almost sort of scars on the fence. And I think about that as the current healthcare landscape. And I think of those lines as the legacies of discrimination and of barriers to access to care for people with disabilities, including people with autism and IDD. And you can sort of try to pull down the ivy, but then it grows back up. You can see some tendrils of ivy growing back up. And I think that's kind of where we are right now. The picture on the right is actually on the same part of the street from a different angle. There's a tree that's bulged out and knocked down the fence. And somebody has put up about maybe 10 individual small posts and sort of nailed them across the tree, trying to kind of very ineffectively create a fake fence around the tree. And I think, again, we have to be careful when we think about telehealth and telemedicine for people with autism and IDD to not do some version of this picture on the right of the haphazard fence, and think a little bit more about what's really going to work and be creative, but also be effective. So with that, next slide, I think I will pass it off to my amazing colleague to talk about how we can think about the future of IDD and autism and telehealth. And again, I like images. There's a picture of a beautiful sunset sky with oranges and blues and pinks and a skyline in the background. So with that, I'll pass it over to you.
Thank you so much, Dr. Tabor, for introducing all of your wonderful research, and again for inviting me to speak on a really important topic for everybody, but also for myself as an autistic individual. I mean, so even with that massive description about everything that Dr. Tabor is and has accomplished, there's something so much more that's wonderful about her, and it's her commitment to community-engaged research and really working with the autistic community to elevate their voices and perspectives. And I think that for me as a researcher as well, that's one of the most important things that we can do in spaces when talking about disability. I think historically and for so long, conversations about disability have been done without disabled voices that are included. And so when I was working on my project and met Dr. Tabor and was interviewing her and heard so much about what she was doing with her work and including those perspectives, and then she ultimately invited me to speak with her and supplement her conversation with my perspective, I immediately said yes, because this is the kind of work that I'm so happy to be, engaged in and just doing the good work with the right people. So I can't thank you enough. And I think it does really transition to the main key of what I want to speak about today. So you'll hear a lot of overlap in the conversation that Dr. Tabor spoke about with her research and the findings that she's found. But I think that what's the most beneficial thing that I can do with my perspective is to talk about how, in order to make healthcare inclusive and drive equitable outcomes, we have to show a real commitment to centering the perspectives of those autistic and IDD lived experiences. And that's a caption on top of a diagram that I have here on the left that shows what I think kind of encompasses the healthcare experience for anybody, and specifically an autistic and IDD individual. And it's a bigger circle with 3 domains, and it boils down to systems, provider, and person. And I've been thinking about it, and since this morning, when we heard the keynote speech that was wonderfully done from Dr. Ann McIntosh, she quoted former chairman Andre Gallegos, and he said a really important comment that has stuck with me since this morning. And he said, "We don't have time for polite conversation. We need some action that has to happen. Our house is on fire." And this topic is important to me for inclusive telehealth because I wasn't diagnosed with autism until my early 20s. And I had been navigating mental health care and many different healthcare environments for years of my life, many different diagnoses, many different treatment plans before I was properly and appropriately diagnosed, simply just because the information around how autism manifests in females wasn't understood at the time. So when that happened to me, and I heard former Chairman Gallegos talk about how our house is on fire, I, for a really long time, felt like that house was already burned down. And today, I felt really, really just inspired and overwhelmed hearing all of the disabled-centered perspectives talking about these important topics and how we can potentially look at telehealth and ensure that we're not burning that house down either, but we're actually working all together, community members, providers, and key thought leaders in this area to build something that's different, to build something that's inclusive to disabled people as well. So when I think of the 3 domains that lead to inclusive design and what really makes the experience for an autistic and IDD individual positive in healthcare, I think that there's system factors that contributes health disparities faced. Autistic people have some of the lowest employment rates, hovering just underneath 20%. And there's also societal ableism and stigma. System factors are the things that are leading up to the appointment that you even have with the patient that is blocking their access to care. There's also provider factors. The fact of inadequate training or lack of disabled-centered education is something that medical education is still struggling with, but doing a lot of work to try and increase. And then today, what I think I'm going to speak the most about is the person factors. And those are the factors related to an individual experience with their disability and how it affects their experience and presentation at the doctor's appointment. So before I go further into person factors, I want to make a note that even though I'm going to be specifically talking about the autistic and IDD individual within healthcare, it's not just one person that's usually involved in those healthcare experiences. Oftentimes, autistic and IDD individuals have roles with caretakers and parents and allies who are all extremely important and crucial members of their health journeys. So while I'm talking about what might be impactful to the specific individual in the realm of their disability, it's important to remember the amount of courage and hard work and many different barriers that also exist for individuals' parents and their caretakers as well. The purposes of me focusing on just the individual is that's me speaking from my perspective. So when I see that, key contributors to person factors within these domains of what we can do to make healthcare inclusive really boils down to me as what makes healthcare inclusive is the ability to advocate for oneself most effectively. And these key contributors that I'll list are what I think is the foundation for those things that are to equitable health that are specific to the autism and IDD community. So those key contributors are the heterogeneous community. So the fact that this population is extremely diverse with lots of nuance within the community. Number 2, communication differences. Communication and social interaction challenges are fundamental to the autism and IDD community. So understanding what are verbal and nonverbal cues that providers should be aware of, and also within the telehealth ecosystem, we need to be aware of as well to make sure we're driving inclusive design. Sensory challenges. Dr. Tabor spoke about it recently, more recently in her conversation with her son, and what it feels like really to have sensory overload, or what music feels like and how that actually can impact a presentation in a clinical environment. Executive functioning challenges, and then something that is also extremely important is fear and anxiety that individuals can face actually in a clinical environment as well. So before getting into anything, I want to really drive home the point of the heterogeneous nature of the neurodivergent community, specifically autism and IDD. And here we see a picture a graphic. And what I really like to do when I speak about autism in any capacity is I like to pull in perspectives of all neurodivergent creators. Anybody that has been personally involved in the autism and IDD community knows the impact and really the community that has been founded within social media for these voices in an accessible format to really talk about how they feel their autism and IDD impacts their lives, and also just trying to do a lot of general education for anyone who's interested. So here what you see is 3 little graphics working together from a creator called Neurodivergent Lou. I love her, and there's resource slide at the end of this if you're interested in learning more. But what I think they do is they do a really great job of explaining how much variety exists in this community. And so even when we talk about wanting to create, facilitators and eliminate barriers to telehealth, to eliminate healthcare barriers for autistic and IDD individuals, we have to remember that what's a facilitator for me or what I find accessible could be completely different towards the next autistic or IDD individual, just because of the nature that there's tons of presentations of how this manifests in someone. And so in the graphic, Neurodivergent Lou did a great job on the first one where it says what people think autism looks like. And there's this linear line almost where less autistic exists on one end and more autistic exists on the latter. And I think that that's a very traditional and almost stereotypical way that we've viewed autism in the past in society. And it's this idea that you can either be more or less of something, more or less of your disability. But in reality, which the second and the third graphic show, is that autism is much more complex and nuanced beyond just one simple line spectrum. It's in fact, almost like a circular graphic of rainbow colors where everybody has different presentations of common characteristics in autism and IDD. So things like information processing, social interaction, communication, memory, special interests, and more. These are all fundamental characteristics to the autism IDD experience, but everybody can present with them to a higher or lower point, and that's not better or worse or more severe or less, it's just different. And so that is a really great job on the third little graphic here, where it just shows that this could be an example of autistic profile traits. And it's a circle with all the same symptomatic and characteristic criteria, just showing different levels of those symptoms. So the key takeaway here is that neurodisability is not a one-size-fits-all. Autistic and IDD individuals belong to a highly heterogeneous population, each individual having their own unique set of preferences and support needs. So with that said, I want to dive into one of the biggest foundational pillars of understanding what I believe is the, very concrete, the autism and IDD experience and its challenges and differences within communication. So like I've spoken about before, I think that there are very many stereotypical ways that we've been trained or believed to see autism, and it's sometimes evoking this image of believing that every single autistic individual is somehow non-speaking. And while that is okay for some of the portion, that's definitely not all. There are very many different presentations. There can be hyperverbality as well. There can be selective mutism, and there can be non-speaking, and who all communicate in different ways that are important to understand when we're communicating with individuals and trying to deliver equitable care. And I think that one of the largest things that is important to note here is that the comfort that an individual feels within the provider environment actually has a strong impact on their ability to, or how easy they find communication. So there can be somebody like myself, for example, who might have a just constant baseline of hyperverbality, which is just speaking very quickly, which I am probably doing right now, and apologize for that. But it's also just part of who I am. And if I'm under a bit of stress, or I feel that I don't know how to react with somebody in the room, I might revert to selective mutism, where I actually have a really hard time speaking about how I feel. And that's here shown on the slide, where it kind of does an overview where it says, telehealth often misses essential nonverbal cues, reducing the personal and authentic feel of interactions. So when I don't feel comfortable, I feel like I can't actually effectively communicate my needs in a provider environment. How that impacts telehealth is that oftentimes I rely on a lot of external nonverbal cues when I see somebody actually in person, which tells me the appropriate ways to socially interact with you. It's something that I do every single day just to understand, you know, I guess just come to a common point of understanding how to speak to one another most effectively. But when I can only see a provider from their face above, I miss very important context clues that help me feel comfortable actually communicating with a provider. And it also makes me feel like it's a bit harder to relax and also feel comfortable. So when we're thinking about different settings and how autistic and IDD individuals might navigate different types of care, for example, telemental health, it might be extra challenging to feel like you can actually speak honestly and authentically when you don't feel like you're actually comfortable in the environment to speak with the provider in general. Additionally, there's also things like language processing delays and speak comprehension issues, which can create barriers, especially with poor internet connection or phone-only communication. A strong part of the autism and IDD community is impacted by auditory processing challenges as well, and that's the graphic which is on the right of this slide. And auditory processing is really just challenges with being able to understand and process what somebody is saying to you at the appropriate times. Or, so for example, for me, I rely on reading lips to be able to effectively understand what someone is telling me. So if we are in a situation of telehealth and there is some kind of internet connection where there's a lag and I can't match your lips with what you're saying to me, my understanding of what you're speaking to me might be impacted and I might not understand what you're saying. On top of that, if there's phone-only communication, I might just have to try extra hard to understand what you're saying. And I might feel like I'm not comfortable to ask you to repeat what you've said, but I might have needed you to repeat what you have said. And so I think that here, important things that you can do beyond just like in a telehealth context, but just a provider context, is understanding that when you're working with autistic and IDD individuals, they might need you to slow down and pause between sentences. In telehealth environments, it might be better to provide captions or written directions and summaries of what you've spoken about. Try and reduce background noise as much as possible. And I think that the holy grail of all of autism and IDD interaction in clinical healthcare, especially with telehealth, is written communication. So writing things down for them, emailing summaries of the visit or prior instructions in order to prepare the individual appropriately for the appointment. And so I think that the key takeaway here is that inclusive patient-provider interaction requires understanding of verbal and nonverbal cues in autistic and IDD patients. Telehealth can introduce additional complexities that require consideration during patient encounters. And I think also remembering that sometimes telehealth might not be the appropriate environment all the time for all types of care that autistic and IDD individuals require. For example, a lot of individuals with autism and IDD might struggle from something called alexithymia, which means a challenge to actually describe the feelings and emotions that they're feeling pertaining to just everything, but specifically healthcare. So if I'm in an environment and I feel like I can't explain what's wrong to you, I might need an in-person physical exam in order for me to just point to something or explain something further, and then we could work in a collaborative process to figure out what's going on. And that feels a little bit lost in the telehealth experience. So we'll have to think about how to circumvent that in the future when we do think about these types of conversations. The second foundational pillar to me is sensory challenges. So on the left here, I've provided a little graphic, and it's one of the penguins from the Madagascar movie. And it's a meme developed also by an autistic creator. And the caption says, "When you feel the sensory overload building inside you, but you can't get out of the situation." And it's the penguin and almost a little bit of a dissociated, faded version of the penguin in front of it. And it's funny, even though it's not funny to talk about what sensory overload feels like, but it does a really good job of encapsulating what it feels like to have so much external stimuli going on around you that you can't control while having to navigate listening to a provider, advocate for your needs, and just feeling like you're almost like leaving your body while all of this external commotion is coming on, and you're trying to actually just emotionally regulate yourself in this moment. This often happens in in-person clinical environments where sensory challenges are very strong. Fluorescent lights, just different environments, getting to the appointment. Maybe it's that tag on my shirt that won't stop scratching, even though I thought I removed it, but now it's bothering me. Or the ringing of the phone in the lobby. All of these things can make it harder for somebody to emotionally regulate themselves and feel like they can talk to you and advocate for themselves appropriately about their healthcare. But this is something that also impacts beyond just in-person environments, but it can also impact telehealth environments, even when someone's from the comfort of their own home. So one of the important considerations that I've bulleted here is anticipating the clinical experience and its role in sensory challenges. So with Dr. Tabor's permission, she shared a story with me when we were talking and designing these slides together one of the first times we met. And she shared a story about how her son was navigating a telehealth appointment earlier, and he was expecting to see a provider that he had been routinely seeing already. And when he logged on, there was a different provider because he hadn't been alerted that that original provider was now on maternity leave. And kind of talking about the impact that that had and the very real impact that it had on his ability to navigate that appointment. And I think that that's a great way to really speak about making sure that we're letting people know, and the individuals with autism and IDD, how to prepare for the environments. Because just because it's not in person and we haven't been there before, we might need you to help us and actually tell us what we can expect on beyond just a physical environment level, but a logistical level. So just doing the extra step of making sure you're communicating by email, hey, we've had a recent change in providers, or prior to our appointment, make sure to log on 5 minutes early. Different little things like that where you can help create an environment in somebody's head. Since you don't have an office in this moment when you're interacting with the patient, actually creating that for them so they can understand how to relax and what they can anticipate. Because if they can't, then once again, that ability to emotionally regulate or feel comfortable in that environment starts to decrease. And suddenly it'll be harder for them to advocate and feel comfortable in the environment. Relationship to home environment is also an important topic. Somebody might not feel comfortable at home. Comfort and privacy concerns. People might live in group homes or feel like they don't want to talk about sensitive information in front of their parents or their roommates. And just beyond all of that, the sensory challenge of feeling like I don't know where to make eye contact with you if I'm not in person with you. That's an additional barrier that I have to navigate. Or the light from the screen, or the sun that won't stop blaring from the window that's looking at me right now. These are all things that might contribute to sensory overload and make it more difficult for the patient to actually interact during the appointment. So the key takeaway here is that sensory difficulties for autistic and IDD individuals persist in telehealth even at home. And these pervasive challenges must be addressed to ensure equitable and effective care. The next slide is executive functioning challenges. So executive functioning, especially within the disability community, usually people talk about how much energy they have to operate in able societies by the amount of spoons they have, just indicating energy levels. Everybody has a different amount of spoons for the day. I might have 60, and logging on to this conference today, that might have been 1 spoon, and talking at this conference today might have been 59. In that sense, it's also very real when we're talking about navigating clinical environments. So in-person interactions with executive functioning, getting to the appointment could very much be 30 spoons, even though somebody else might interpret that as just driving to the appointment. I think about that as getting into my car, realizing I don't have enough gas, having to navigate the GPS that I don't know how to connect to my car, and making sure I get to the appointment, find parking, pay for parking, and then navigate an environment that I don't know and I'm not comfortable with in person. In telehealth, there are similarities that mimic in-person challenges like that as well. I might have challenges with digital literacy. I might not know how to operate the EHR appropriately or understand how to log into the appointment. I might have challenges navigating various platforms, like the 100 different kinds of usernames and passwords we have to remember today. And that might be challenging for me to understand or remember which password I need at that point. Updating camera and video software, and managing a low computer battery. These are all things that happen before the appointment that take executive functioning, and they lower the amount of spoons that I have to be able to actually show up and advocate for my care in that in-person environment. So the key takeaway here is that just as executive functioning difficulties present challenges in the physical world, they appear just the same in telehealth formats, just manifested in different ways. And on the right, there's a graphic of the emotional impact of executive dysfunction. And oftentimes when someone is having a hard time and low on energy, they might not be able to connect, cannot predict outcomes for big decisions, cannot arrange steps in their mind to be able to make an informed choice, cannot hold information in their memory to feel like they can make a decision about anything, and they cannot imagine possible scenarios to plan for emotionally or practically. So that's something that you can imagine struggling with all of that in a care provider appointment is extremely essential. So practice and provider flexibility is of the utmost importance, even if you are extending your appointment time or being okay if the patient arrives 5 minutes late to the appointment. Being as flexible as possible is something that can actually provide the patient just that extra nudge to help them relax in that moment and have an actual agency in their care decisions. And then the last pillar that I have here is fear and anxiety. And I think that it's something that's not spoken enough about, but there is a large amount of courage that it takes for any disabled individual to go to a doctor, especially when oftentimes, and I felt it myself, having to navigate different care environments for years until, I was even diagnosed with autism, is just the feeling that what you feel in your lived experience is invalid, or even the very raw reality that you might have to constantly be in a position where you're teaching some of the providers about the condition because they haven't had the training about it. And because of that, there's a ton of challenges for autistic and IDD individuals when they're in the patient room. Poor mental health comes due to social isolation and lack of support, difficulties accessing and navigating virtual platforms, absence of nonverbal cues in telehealth. You might not see it, but somebody can be extremely scared and anxious when they're talking to you as a provider, and it might be taking every last thing that they have inside of them to show up to that appointment to actually advocate for themselves. And I felt like one of the best ways to explain that was on the right, I have a portrait that Frida Kahlo painted in 1943, and it's called Roots. And what it is a self-portrait of herself. It's a Mexican woman with long brown hair and her trademark unibrow that she always has. And it shows her with roots coming out of her entire chest, arguably bleeding out, but maybe not. And a lot of people have discussed with this portrait, is this a way that she's used to symbolize hope in her life and overcoming extremely distressed moments? Or is this actually a time where she's describing as one of the most distressed moments of her life? When you look at her personal life, in the events that she was having at that moment, this portrait might indicate loss. But when you look at her face, and the reason why so many people have debated whether this is, a hopeful portrait or a portrait that's extremely, depressing and sad, is because her face is seemingly almost emotionless in the way that we understand and characterize different facial expressions. And I think that that's the best way to show how somebody might be feeling who's autistic or IDD in the moment of the clinical experience. You might have been taught that somebody expresses fear by their face, but that individual might actually be protecting themselves and shielding their emotions in that moment so that they're not, perceived as anything weaker, because that's the way they've sometimes been made to feel in these clinical contexts. So they might be hiding their emotions, but that doesn't mean that you aren't going to honor them. So for my last slide, these are the takeaways, which is pretty much all the key takeaways that I've had from the previous slides. And I just want to say that I know that as providers and whoever's listening today in the audience, it's so incredible that we're having these conversations, and there might feel like there's a lot of difference and nuance in the community, and it might be hard to get it right. But I think that the important thing is just to be open and celebrate that difference. Feeling different is extremely, beyond all the changes within diversity within the community. The feeling of difference is like the cardinal thing that everybody can connect to. And I think that oftentimes non-disabled society looks at difference and gets scared. But you shouldn't have to, because I think that one of the most important things that you can do is just to make someone feel comfortable. Be knowledgeable, be curious, ask questions, get to know somebody, be flexible, be empathetic, be you, and feel okay to actually, tell yourself, I'm not, the expert at this, so help me understand how I can accommodate you. So that's what I have for you today. These are some resources if you're interested in learning from more autistic and IDD informed perspectives. You can scan the QR code below, and there's some links to some great books, social media accounts. And also, if you have any feedback on the session or ever want to talk or have further questions, please feel free to email me on my email below. Thank you.
Thank you, Susanna. That was wonderful. And thank you to the organizers. We don't have a lot of time. I think we have to go. I do want to point that in the Slido, there was a good comment about some of the challenges related to the environment, and that telehealth allows people to choose their own, and neurodivergent community choose their own environment, and they don't have to use up energy to transverse bright lights, disturbing sounds, uncomfortable furniture, smells, migraines. So thank you for that comment. With that, I think maybe in the interest of time and staying on talk, I'll hand it back to Dr. Srinivasan, but I want to echo Ms. Skvarkova's invitation to reach out to either of us by email. My email you can search online for. So thank you so much, and thank you for the opportunity to speak today.
Oh, Dr. Tabor, Susanna, this has just been so wonderful. And Susanna, thank you for really bringing to life all the research that we've been talking about. I think that although I know you said you were speaking for yourself, I think you were speaking for multitudes. So it was really wonderful. And I think that all of us have learned a lot from you, and hopefully we'll continue to learn a lot more. So with that, I think that we're going to really just deepest thanks